facts are stubborn in the field of health emergencies in Africa, like an eternal beginning. In October 2017, in the African region of the World Health Organization, the WHOAFRO, which has 47 member states, about 30 epidemics were declared. A dozen recorded humanitarian crises, and about 40 events were considered in the region as involving risk to public health that could harm the health of human populations, likely to spread internationally or pose a serious and direct danger. And all this in less than 2 years after the Ebola disaster and its 11,000 deaths. The World Health Organization, whose main responsibility is to administer the global system to combat the international spread of disease, has, of course, strengthened its response and capabilities. It is true that the WHO was recovering from the turbulence that had shaken it and the controversial management of the Ebola epidemic in West Africa. Drawing lessons from this unfortunate experience, regional meetings were organized to share new intervention strategies, remobilize, and reinvigorate the means in the states of the African region.
Our main mission is to save lives, therefore prevent cases of avoidable diseases and death during emergencies or situations of health risk. So we are working with countries to build their capacity to be able to do prevention, because the first public health action is prevention. Next to that, we build capacity in order to detect these public health emergencies in time, so that they can respond with all the energy they need before they degenerate into a major emergency.
In the huge building of the WHO Regional Office for Africa based in Brazzaville, Congo, a space has been set up and equipped with the best communication technologies to manage health emergencies. The shock room.
Welcome to the Strategic Health Operations Center in the WHO African region. This is a central location where all public health emergencies are managed. The center helps us to communicate in real time with response personnel in the field, our WHO country offices, as well as with regional and international partners. The center also helps us to get real-time information from the field, which helps us to make strategic decisions. From the information we get, it helps us to know what kind of resources, what kind of support the countries require.
And this center, transformed into a real HQ, was created in 2010. It is connected to all 47 country offices of the WHO African region. This is where health emergency interventions are prepared and coordinated. They have here all the experts whose event of the day requires skills. They're also the bearers of the entire device that governs precisely the different phases, ranging from monitoring, verification, and notification until the outbreak of the health emergency program.
We must first look at the human resource capacity since the WHO emergency reform in mid-2016 until now. We have almost doubled our capacity in terms of human resources. We work on several platforms, from the regional office in Brazzaville, but also from Dakar and Nairobi. We also use our logistics capacity with an inventory reserves we have in Dakar, Harare, and other areas that are even outside the region, which are global reserves. We work with partners who have an important logistic capacity, such as the World Food Programme. For example, during the recent Ebola outbreak in the Democratic Republic of the Congo, we have used the WFP aircraft, of course, with the WHO funding, to be deployed very quickly in very remote and hard-to-access areas. So we continue to use emergency response mechanisms, and we have made a lot of progress between last year and today.
Let's go back to the starting point. The member states of the region. WHO helps them, at their request, to acquire, strengthen, and maintain the ability to detect, assess, report and report events.
Le bureau régional de l'OMS pour Afrique a mis en place le programme sanitaire des urgences.
The WHO Regional Office for Africa has set up the Emergency Health Program, which aims to bring countries to early warning, early detection in order to provide responses, and also an effective and rapid one.
Donc, mon unité, mon programme s'occupe essentiellement de la préparation.
My unit, my program deals primarily with preparation. As part of this preparation, we have since last year the regional strategy for health security, which contains frameworks and strategies that are made available at the member state level, including integrated surveillance of the disease and the response, but also the international health regulation, and finally, the disaster and risk management framework. So all these three strategies and frameworks are made available to deal with the emergencies.
Les cadres sont mis à disposition pour parer à des situations d'urgence.
If a state has evidence of an unexpected or unusual event in its territory, regardless of its origin or source, that may constitute a public health emergency of international concern. That state must then provide the WHO with all relevant public health information.
La première des choses à faire, c'est de collecter l'information relative à cette situation-là, la vérifier.
The first thing to do is to collect information regarding the situation, verify it quickly, work closely with the Ministry of Health, and ensure that we have the information that allows us to make the decision in a timely manner. We must confirm or deny the epidemic that is suspected, and this is the first action to take. Once this is done, if ever the epidemic is confirmed, there is a battery of measures put in place by the Ministry of Health with the technical support of the WHO. I believe that most of our countries have adopted the international health regulations and have put in place mechanisms to monitor these diseases with epidemic and pandemic potential. On a regular basis, countries report information to us. When there are difficulties in obtaining information, there is a team of experts working with the Ministry of Health to verify the information that allows us to make the decision on time. One of the critical points that is currently being implemented by the WHO is the risk assessment that allows us to know the level of risk associated with an epidemic, and depending on the type of risk, we can determine the type of measures that must be put in place to contain or limit effectively the epidemic where it occurs, to prevent spreading at national, regional and international levels, thus saving lives.
International et permettons ainsi de sauver les vies humaines.
When the WHO is informed of an event that may constitute a public health emergency of international concern, it proposes to collaborate with the state concerned in the assessment of the risk of international spread of diseases, of the obstruction of international traffic which could be created, and the adequacy of the control measures. These activities may include collaboration with other standardization organizations and the offer to mobilize international assistance to assist national authorities in conducting and coordinating on-site assessment.
Pour rentrer en action, on utilise les informations recueillies par le département qui gère l'information.
To get into action, we use the information collected by the department that manages the information, and therefore we try to scale up the level of intervention required by the WHO.
Donc, l'échelle au niveau 2, qu'on appelle le grade 2, il s'agit d'une réponse qui vient principalement du
We start from a scale of 1 to 3. So, for grade 2, the response that comes mainly from the regional office with the support of the headquarters, and level 3 is a major emergency where headquarters, the region, and even other WHO countries are providing support to respond. So the purpose of this deployment is to support the Ministry of Health through various functions. First, there is the partner coordination function. incoming partners need to be aware of what needs to be done to stop the epidemic. Then there is the technical support depending on the type of disaster or the type of epidemic. We have experts who are deployed. We also deploy the team that manages the information because we have to monitor the epidemic. Is the trend up, down? What are the risk factors for communicating with the population? What are the new hotspots, or how quickly social mobilization is needed? All these aspects need management. Then we have logistic support that is needed to deploy all these teams in the field.
L'appui logistique qui est nécessaire pour déployer toute cette équipe sur le terrain.
Emergencies are increasing in the WHO African region. Outbreaks that have disappeared from most continents are still present in Africa. Worse still, some declared eradicated reappear.
Au niveau de la région africaine,
At the level of the African region, there are major constraints that deserve to be highlighted. When we look at the determinants of this health problem, today we have epidemics of cholera in at least a dozen of 15 countries because people simply do not have access to drinking water, and the problem of sanitation arises. But that's the government responsibility, even beyond the health sector. So it is important to set in place these preventive actions. And to protect people, it is important that governments invest more in health and safety. We often talk about it for the protection of the countries in general, and with regard to the security, our government does not hesitate to invest more in weapons. But when it is a question of protecting populations with regard to the health risk, the investments are really low, or we wait for partners to come from outside to secure this funding. It is important, first of all, that domestic financing be provided to put in place the minimum capacity at the level of this country. When we are reviewing capacity for international health regulation, there are extremely important gaps in many countries, and we need to bridge these gaps in order to prevent and respond to these public health emergencies in a timely manner. This will reduce the cost of life, but also minimize the socioeconomic consequences of this issue.
les conséquences socio-économiques de ce problème.
In the shock room of the WHO Regional Office for Africa, men and women scrutinize these maps and data every morning. It is a rigorous exercise that they engage in by constantly remembering that their primary mission is to save lives.